Thank you for joining us for our information video, one of 8 in the series we are offering to men as a free resource receiving hormone therapy for prostate cancer. My name is Louise Field, the founder of Adore Your Pelvic Floor, and today we are covering strength and conditioning and its effect on hormone levels. Our expert today is Bill Taylor, a physiotherapist with over 30 years experience in the treatment of pelvic dysfunction. Bill is widely recognised in the UK and internationally, and he is one of the leading pelvic health physios. Bill, you have a special interest in chronic pelvic floor dysfunction and the use of manual and exercise therapy in addressing this condition. You are a consultant physiotherapist with the Scottish Ballet and also the Scottish Dance Theatre. In fact, you've worked with them for over 20 years. You are also a visiting lecturer at Edinburgh University. You're looking embarrassed now. You're like, okay. And you contribute to the MSc in dance science and education, and you teach the preventative dance injury model. Bill, you have recently become a member of the visiting faculties of Burnell and Keele universities. And from this intro, it is obvious that you are the ideal person to actually help us in this subject for the men in the community with regards to strength and conditioning. So thank you so much for joining us today.
Well, thank you very much for asking me along, Louise. As I say, I'm quite passionate about getting people exercising and getting them sort of back into the gym, back off the sofa, outside. And I think after lockdown, we all need a little bit of help to get back into the fitness levels that maybe we were at before. So I think that was a very, very generous introduction. Thank you very much.
That was only part of it. I could have gone on. I could have gone on. So what is the current strategy for pelvic floor training, and how does it differ from the traditional training model?
So I think the biggest thing for me, I mean, I've been in this business for a long time, and the biggest thing that I've seen over the last X number of years is this idea that training is much more functional. Training used to be very kind of bed-based or chair-based, and you would go along to your physio and they would teach you the traditional Kegel exercises. And for men, there's been evidence in the last few years to say that we need to, first of all, we need to teach men to retrain their pelvic floor muscles in a different way. They need to be cued differently. They need to look at their pelvic floor muscles in a different way, and they need to contract them and make sure they're working. But more than that, it's all very well to learn how to contract your pelvic floor lying on a bed, but that's not what we do. What we do is we stand, we sit, we squat, we lift, we bend, we do all the things that we're meant to do in our lives. We chop wood, we lift shopping bags, we climb in and out of cars. And it's those things that I hear men have trouble with. And I suppose, because my background is also musculoskeletal physio, if someone came to you with a condition that you needed to improve their function with, you would get them doing resistance training, you would get them doing functional training, you would get them moving. And so a long time ago, I started introducing this idea of resistance training before there was really any evidence for it. And I treat both men and women, but in my blokes, especially post-prostatectomy guys or people having hormone replacement therapy, hormone therapy for prostate cancer, there is this kind of idea that maybe if you've got cancer, maybe you're fragile. And I think sometimes with men, we need to work on making them anti-fragile. We need to, and I would say, build the resilience. Let them understand that their bodies haven't failed them. Let them understand that we can take what we've got in front of us and start to introduce fairly heavy-duty training regimes to help improve their pelvic floor function. So the biggest change for me is this move from so specific focus on Kegels to a much more functional approach.
Amazing. I could listen to you for hours. You talk so lovely here. So why should I actually strength train if on hormone therapy?
Well, you know that prostate cancer is the most common cancer in men, and many patients are undergoing radiation treatment and hormone therapy if they're not going to have a radical prostatectomy. And I think the side effects of hormone therapy are really difficult to manage. And a common side effect of hormone therapy is muscular atrophy. And there has been studies that have found resistance training to be effective in counteracting muscular atrophy. But what they did find that muscle building will take longer than usual in patients that are experiencing this. So I wrote a few things down here because basically common side effects of hormone therapy are, there's some sexual issues. You get decreased libido, erectile dysfunction, you get breast changes, gynecomastia, breast pain, you get loss of bone density, increased risk of fractures and osteoporosis. Then you get changes in metabolism and your muscle mass. So you get increased risk of metabolic syndrome and diabetes, increased body fat. So you can hear that these are things that, although they're caused by the hormone treatment, sometimes, not all men get all of these, but some men get some men get not very many, some men get a lot. You get vascular and cardiovascular systems, you get increased risk of deep vein thrombosis, heart attack. So it sounds really nasty and you think, oh, I don't want any of that, but this is the stuff that's going to save your life. So you have to take the treatment. But a lot of these things can all be ameliorated, if you like, made a little bit better by exercising. So, you know, this treatment, the combination of radiation therapy and hormone therapy is a proven treatment against cancer. So it's worth doing. It's worth going down that route to do it. And it works by inhibiting testosterone production. And as I said, all of those things that we talked about with the side effects is a result of the fact that testosterone is involved in many different bodily processes. Because testosterone functions as kind of a caretaker for the muscles. And it also, it keeps you young, if you like. It keeps you fit and healthy because an absence of testosterone accelerates the aging and the natural deterioration of the body. So the kind of things that I think, as I said already, muscular atrophy and reduced muscle function, loss of bone mass, weight gain, tiredness, and also lack of energy and drive are all the things that you get with this treatment. And there's a few studies have demonstrated that resistance training may reduce a number of these side effects. There's not that many studies been done. But if you've got, so as a physio, what my job is really is to tailor an exercise program that can help reduce some of the side effects of hormone therapy because I use a combination of muscle building, weight training, with aerobic exercise, running, walking, cycling. I use impact loading because it's useful for prevention of bone density loss, includes jumping, hopping. Then you need a properly designed exercise program that can reduce fat buildup, increase lean muscle mass, reduce fatigue, and promote bone strength. So I think all of those things are really important. But I mean, do we know if there's any evidence for it? Well, there was a paper in 2015 by Nielsen et al. Who looked at the effects of strength training on body composition, physical functioning, and quality of life, which I think is really important because I think as physios, we're sometimes quite focused on the medical model. And so we kind of like, maybe what we do is we think, well, yeah, you should definitely do this. But actually, we have to say to patients, well, we've got the evidence that this can make a change. And this study looked at the effect of 16 weeks of resistance training on patients that were undergoing hormone therapy. And they looked at, they measured fat-free body mass. They collected tissue samples from muscles to check what their muscles did. And they looked at the effects of resistance training on body fat percentage, bone mineral density, muscle strength, and then performance in different functional tests. And I liked this study because it was things like the things that you want to do, like running up a flight of stairs or getting up out of a chair. And I know that sounds kind of simple, but actually it can be a big problem. They looked at 58 men, so not a massive number, but not bad. And half undertook a resistance training program consisting of 5 exercises, 4 upper body exercises, and 5 leg exercises and 4 upper body exercises. So well doable, because the other thing about this is if we're going to give patients exercises, can they do them? Do they have the time during the day to do them? Do we give them exercises that make them so exhausted they can't do them? They were working out 3 times a week. But the important thing for me was they were continuously increasing training volume. Because one of the things I find that physios is we tend to underload our patients. We tend to not put enough weight on them. We tend to think, oh, they've got cancer, we better treat them with kid gloves. Well, you know, your body's fighting a tough fight, and actually helping it be stronger, I think, is really valuable. Anyway, what they did was they looked at muscle and fat measurements. We're taking pre and post training. And then what they found was, which the one thing about this, that this study utilized a higher training volume than other studies had. And the subjects in the training group had gained a significant amount of muscle mass in their legs and arms. And they, hold on, I don't want to get this wrong. I want to actually say what I've written down here. So let me just see if I do, let me see if I do this. Do I stay here if I do this? Do I disappear? No.
I can't see anything.
Yeah, you can't see me.
I can see you. Yeah, yeah, you don't disappear.
Yeah, okay, good. So what they did, they didn't find really that there increased muscle mass in the trunk, right? Because they were a bit surprised about this, because what they found in other studies was that if you start giving healthy seniors resistance training, they find that their core started to get strong. But in this group, that didn't happen. However, what they thought it was partly because shoulder and pectoral muscles are much more sensitive to testosterone compared to other muscles and muscle groups in the body. And this might have an effect on the prostate cancer patients undertaking resistance training. It was maybe the type of exercises that they had picked for them to do. Interestingly, the patients in the study gained about 1/3 as much muscle mass compared to what a group of healthy male seniors recorded. So a third as much. So these guys on the hormone treatment actually gained more muscle than a crowd of healthy elderlies that were training without the hormone treatment. So the results were really varied widely, but some patients respond really well to the exercises and increased their muscle mass by more than 3 kilos. Others achieved some average results and gained just under 2 kilos. Interestingly enough, 10% lost a kilo. So even in spite of doing the exercise, some of them still lost stuff. And they don't really know what that's about, other than the fact that hormones affect people in different ways. They found that resistance training in this study had no effect on body fat percentage and bone mineral density. Now, however, what they did find, which was probably more functionally useful, was that the subjects in the resistance training group improved more in the strength tests and the functional tests compared to the subjects in the control group. So it made you more able to do things during the day. And you know what? If you're a granddad and you want to play with your grandkids, or if you want to be fit to do that, there's some evidence here that getting you stronger, it helps your life be more full, and you can do all the things that maybe you think you can't do.
Yeah, and that's so important.
I think it's really, really important. Interesting enough, there was just because I'm kind of a bit obsessed with the kind of minutiae and the physiology of this, is what they found was that the biggest change when they looked at the muscles, because they took the muscles and they tested them, and what they found was that the biggest loss of muscle fibers were in slow twitch muscle fibers. And it was suggesting, and that's the muscles that are like about posture, not really muscles that produce strength and power. And they thought that the hormone therapy affects muscles differently from the muscle loss caused by aging. Because as we all get a bit older, we get a fancy thing called sarcopenia, which is where we start to lose muscle mass. And that's where fast twitch muscles are more affected. But what we found was that it was really the slow twitch muscle fibers were affecting this group. So that's an interesting finding. So I think what my feeling is we're always looking for evidence to see whether or not we should be doing this, and whether, I think some men say to me, well, I didn't start my exercise at the beginning. I haven't seen you, Bill. I'm 6 months down the line, and is it worthwhile starting exercising now? Well, there was a study done just recent 2020 that looked at the immediate versus the delayed effects of exercise. So they looked at 104 men, and they were hormone therapy for at least 6 months. They wanted people that were non-regular exercises at the time. And it was a randomized control trial, which means it's a really good study, and we can listen to those results because it's kind of top class evidence. They were put into two groups. They started exercise at the same time. One group started exercising at the same time as the hormone drugs. One group started exercising 6 months later. And the aim of the trial was to compare the results for men who started exercising early and continued it for a year, as to another group of men who started at 6 month delay and then exercised for 6 months. Again, they were doing it 3 times a week for an hour. Now, in a study, that things have to be very kind of specific, so we can say that we don't have any variables, nothing changes too much. And these guys were supervised by an exercise physiologist in groups of 6 to 10 men, and they were in a gym. And it was, again, the kind of exercises they were doing were jumping, hopping, skipping, aerobic, and some resistance training. And they all had a warm up and a cool down. And in 2019, the reports from this really said that they measured things like bone mineral density, so how strong your bones are, that how much muscle tissue you've got, and how much fat have you got in your body, fat mass. So what they found was, if starting exercise early slowed the loss of bone mineral density in the spine, it also slowed the changes in lean muscle mass, which is what we're really after, skeletal muscle mass and muscle density. So it basically really helped your muscles stay good, strong, made you keep muscle mass, and meant that you didn't actually lose your strength. Men starting exercise early still gain fat around their bellies, which is one of the side effects of, as well as getting older, drinking too much beer, but also from androgen therapy. And this gain in fat was not as severe as for the men starting exercise later. So if you started your exercise earlier, then you kept your belly smaller. By the end of the study, many of the differences other groups had evened out. So what that really meant was, although you might not have started at the very beginning, it didn't matter so much because you could kind of catch up. In 2020, what they did was they went back and looked at the same group of people, and they examined the ability of exercise to slow the loss of muscle strength. And they, again, just really enforced that starting exercise early preserved and in fact improved muscle strength and physical function. And those that started to exercise a little bit later had a loss of muscle strength and physical function. However, which is always good news, this was returned and improved. So it was never too late to start the exercise. It was always because they improved after the 6 months of exercise. And by the end of the study, significantly, there was no difference between the two groups. So basically, this trial has shown that there are benefits for starting an exercise program at the same time as starting hormone therapy for prostate cancer. And it's also shown that a supervised exercise program with aerobic impact and resistance training have helped maintain bone density and muscle mass, and it improved muscle strength and physical functioning. So, I think it's good news all the way, but what does it mean for your trainer? What does it mean what do you tell the guy that you're working with in the gym? Because let's say maybe some trainers aren't maybe so used to working with cancer patients. Well, resistance training, you can tell your trainer that it's recommended for prostate cancer patients, but you need proper guidance and supervision. And, physios and trainers, I work really closely with trainers and Pilates instructors, yoga teachers, because I think we need to all be working as a team together. The idea that patients will say, well, how many times do I need to do it? Well, 2 to 3 times per week, using basic exercises involving large muscle groups. And it's wise probably to combine resistance training with cardiovascular exercise, because that combats muscle atrophy as part of the natural aging process, which might be accelerated by hormone therapy or might happen in parallel to hormone therapy. And also, it can help you generally with cardiovascular disease. And even starting exercise after the onset of hormone therapy can still provide benefits. So I think that's the science of it, really. So it's a bit of a long-winded kind of answer.
No, but that kind of covers a lot of my questions.
Oh, cool.
And also, I think the questions for the guys that are watching this, I think it'd be really interesting to know what are the basic principles when you are strength training to then, for our men to then be able to take it to their gym trainer.
Sure.
Because we aren't all going to be able to have access to the trainers that are working in this field. There are those trainers, and they also, you can find them if you inquire at your local hospital where you're having your treatment done, and also look up the organisations that we will be listing in the description. So you can get support there. But if you're going to your local gym and you're having to think about your principles for strength training, what are they, Bill?
Well, I think you have to, first of all, overload. You have to lift heavy enough weights, and you have to work to fatigue, or you have to work to, till you can't do another exercise. You have to work till you're absolutely exhausted. And I think sometimes, the idea if you have a cancer diagnosis, there's an idea that in actual fact you should exercise maybe not to that limit that you should exercise. So I think you're looking at, you want to, if you want to increase strength, you want to do high load, but you want to do a low number of reps. So a maximum of 5 reps and maybe 3 to 4 sets of 5 reps. Now, some people might argue with this. I've done quite a lot of work with Claire Minichel, who's a very well-respected strength and conditioning trainer. And I really like Claire's work. She's quite kind of science-based. And she would say, I think this work, the things that I believe really I've learned from her. So I would say that, you want to find, you get your trainer to work with you to find your 1 repetition maximum. So that is the heaviest weight that you can lift once and then can't lift again without a considerable rest period. You take 75 to 85% of that, and then that becomes your 5 RM. And you do 5 repetitions of those. Now, if you only get to 3 or 4, it doesn't matter, because that's where you want to be working at. You want to be working at that level for strength. Now, if you're thinking about hypertrophy, if you want to make the muscles a bit bigger, if you want to bulk up a bit, go to the beach, or you just think, I think I'd like my arms a bit bigger, then you're looking at maybe 65 to 75% of your 1 RM. And you're looking at probably maybe 8 to 12 repetitions or 10 to 12 repetitions. So a few more repetitions at a lighter weight. Now, I read an article the other day that said, if you were looking at endurance or increasing size of muscle, it could be anything with a lower weight. It could be anything up to 100 repetitions. And I thought, ooh, that's a lot. I thought you'd be there all day. Because I think one of the problems with so my feeling about that is you want those specific strength training parameters to be put in place. You want to be definitely loading up heavy for strength. If you are thinking endurance is more of a problem, reduce the weight by 25% or so, increase the number of repetitions by about 20-25% as well. And tell your trainer that to almost treat you just like normal. Just train me like I'm a normal person. Let's see how my body responds to that intensity of training. And also the fact that you need some cardiovascular training on top of that. So I think, and cardiovascular training, that's quite a complicated kind of area to decide, do you want to be, there's different ways of measuring that. One of the ones is kind of a perceived exertion, like how tired do you feel? And there's a scale that can measure that. And your trainers will know about those things. And I think, there's some really good quality strength and conditioning trainers out there, some really good exercise people, and people like yourself that know what they're doing with pelvic floor patients. And I think, I just say to them, tell them just to treat you like normal, and let's see how you go. And I think, I think it's important that you do cardiovascular training alongside the strength and conditioning training. But I think as well, it's always going to be, there was a study done recently looking at shoulder patients. And it was an interesting question they asked. And the question asked was, what's the best exercise for shoulders? Because sometimes people say to me, what's the best exercise for this? What's the best exercise for that? And the answer was the one that you do. So it's kind of like, and it's a true thing, because it's kind of like, sometimes, I'm keen to get my patients motivated, but I also don't want to overwhelm them by saying to them, you need to exercise 45 minutes twice a day, every single day. People are going to look at you and go, what? I don't have time for that. I'm busy working. I've got a family. I've got grandkids. I've got grown-up kids. I've got stuff to do. So it's about finding something that fits with your lifestyle. It's about something that fits with the time that you have available. And there's also the question of kind of cost as well, because gyms can be quite expensive. And although I do know that, in Edinburgh, we have some pure gyms which have opened up, which are like $10.99 a month to go and enjoy, which isn't a lot of money, but for some people that can be a lot of money. And so there's lots of stuff that you can do at home with regards to kind of, sit to stand squats, like deadlifts, upright rowing, chest. But there's a whole bunch of stuff that you can do, body weight exercise. And also, I think when I went on Claire's course, and Claire's very kind of technical and uses lots and lots of heavy weight lifting. But actually, she gave me the idea of filling up 2-litre old water bottles with water and putting them in a backpack, and suddenly you have a whole gym. Because if you've got 4 2-litre bottles of water in a backpack doing squats or deadlifts or getting out of a chair, there's lots of different functional funky things you can do around the house without actually going to a gym. And even if you can't afford a gym membership, you can get like a one-off session with a trainer that will write you a program, that will give you a program, send you away. And the other thing I quite like is near my local, near my house in Edinburgh, we have like a park, and the park has a kind of a circuit around it. So you can be outside, take your backpack with you, and there's dips and pull-ups and all sorts of things. It's all free. You can go up there. You're also in the fresh air, although in Scotland, sometimes the air is a bit more fresh than we'd like it to be. But, there's lots of, you don't have to be constrained by, by the fact that, things are expensive, or that you can't manage to get there. If you're working out in the house, then you have less of an excuse not to do it. and also, if the weather's a bit rubbish, you don't have to go outside. So I think it's important just to say, how do we get the exercise to happen? Because it is all very well you and I having this conversation, but if it doesn't actually happen, if it does, and listen, I'm the same. I'm sitting with my exercise bike here on the left-hand side of me that I haven't been on for about 3 weeks, and I keep thinking, yeah, I better get back on that. So it's one of those things. We need to motivate people. We need to make sure that they do it, and hopefully, that today some of the evidence that I've presented will encourage them that there's some science out there to back up the fact that it's a good thing to do.
I just think it's amazing, and it's finding everything you've said in one hit. Really is find what suits you, get on with it, just do it.
Yeah,
in the park with your trainer if you want to.
100%.
Get your high weight with your less reps, mix in your cardio, and you're done.
Yeah, absolutely.
And it doesn't have to take long, does it?
It doesn't have to take. No, it doesn't have. I mean, it doesn't have to take long. I mean, I think so. What I find with exercise is when you start out, you go to the gym for 20 minutes, half an hour, 40 minutes, and then you kind of like it a bit, and then you get a little bit of a buzz from it, and then you might go for an hour, sometimes, and then suddenly it's that kind of getting back into it. It's getting started, and I think sometimes there's if you get a diagnosis of prostate cancer, although it's not a terminal diagnosis often, it can be very, very frightening. It can be very emotional, and it can really undermine your confidence, to exercise. And it is that idea that you've lost a bit of trust in your body. You think, how could my body let me down? And it's almost about taking back control of that a little bit and understanding that it's safe to do that. Because I think you'd have the questions like, will exercise make my cancer worse? No, and there's lots of evidence out there. I think the Australian Oncology Association about 2 years ago, at the very, very top of their list of treatment modalities, they put exercise as medicine. So no matter what treatment you're having, whether it's chemotherapy or whatever you're having, exercise is key to facilitating a good response to all of those things. And what you just said, though, it's the exercise that you can manage. And we don't want to make people feel guilty because they're not doing 4 hours in the gym 5 times a week. It's not about that. It's about what can you manage? What do you enjoy? Did you feel better afterwards? Mm-hmm. And also remembering lots of different people are coming to this with lots of different fitness levels. I had a patient recently who he didn't have prostate cancer. He had another form of cancer, and he was told that the outlook wasn't very good, and he might last maybe 4 or 5 months at the most. And he basically said, "I don't think so," and started exercising like crazy, and he got 6 years. And so you think, wow, that's amazing. And actually he at the time had put it down to exercise. And so, that's a bit of an extreme example, but I think it's just, prostate cancer, the androgen therapy is really successful. It works really well. So to give yourself an additional help up the ladder, I think throwing a bit of exercise in there is always something I'd encourage.
Well, you're motivating me to get out now and start exercising. I want to have up my training, Bill. Thank you so very, very much.
You're very welcome.
We're going to put your contact details in the description, your website, and also, as I mentioned earlier, other organisations that are go-tos for seeking advice with regards to hormone therapy and men's health. And I thank you very kindly, Bill, and we welcome everybody watching these to feel free to share them widely, because we want them to reach the men in the community. Thank you, Bill.
Thank you very much. Thanks for asking me along. Appreciate it. Bye-bye.
Thank you. Appreciate it from you. Bye-bye.